Making headlines, Kenya is ready to receive American citizens exposed to Ebola in the Democratic Republic of Congo and place them in quarantine centers, despite the move sharply dividing public opinion. The government has granted written approval to the United States to establish a facility in Kenya to quarantine Americans exposed to the virus, with two senior government officials confirming they have been briefed on the Ebola response plan. According to the Ministry of Health, Kenya has a strong healthcare system and remains a regional benchmark in the management of infectious diseases such as Ebola. However, even as Kenya agrees to host American citizens infected with Ebola, the US, which boasts one of the most advanced healthcare systems in the world, insists it will not allow its own citizens infected with the virus to enter the country. Here's NTV's Julius Jomar with a report.
The Ebola pandemic is once again ravaging the Democratic Republic of Congo, with more than 220 people dead and over 1,000 infections recorded so far. The Bundibugyo strain of the Ebola virus is at the center of the latest outbreak in the DRC, with the World Health Organization describing it as the third largest Ebola outbreak ever recorded and declaring it a public health emergency of international concern. Neighboring Uganda has already closed its border with the DRC after reporting 7 Ebola infections and 1 related death.
And coordinate response efforts to effectively prevent and control the spread of Ebola across our shared border.
Amid the growing threat, the United States has declared that no person infected with Ebola will be allowed in the country, even if they are American citizens. During a cabinet meeting attended by President Donald Trump, U.S. Secretary of State Marco Rubio stated that the United States could not risk allowing Ebola into the country. Washington has now initiated talks seeking to have American citizens infected while in the DRC transferred to Kenya for quarantine.
The number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States.
And now, the Kenyan government says it is ready to receive the affected American citizens and place them in quarantine facilities. The government has provided written approval for the United States to open a facility in Kenya to quarantine American citizens exposed to the virus, with 2 officials confirming they have been briefed on the response plan.
International collaborations happen every other day.
Principal Secretary for Medical Services Dr. Umo Luga says Kenya has the capacity to test for Ebola and possesses one of the strongest healthcare systems in the region for handling infectious diseases.
I can tell you without a doubt that countries in our neighboring region are actually relying on KEMRI as a reference laboratory to send their samples to confirm these cases of Ebola. So we are in a very good space.
According to Dr. Luga, Kenya remains a model nation in responding to infectious disease outbreaks, adding that it will be irresponsible for the country to ignore calls for international cooperation in combating the Ebola crisis.
Just like we also may send some of our patients, including, for example, cancer patients, to other countries. You know, this is our expertise, so this is the time to show up.
When there is a discussion around having an isolation center in Kenya, it's not a bad thing, really. As a country, we must be ready. And these are not strange things. Even during COVID, we had isolation centers.
The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has criticized the government over the proposed Ebola quarantine center in Kenya. The union is demanding transparency and wants the government to explain why Kenya has been chosen by the United States and why the country appears to import a deadly disease while local healthcare challenges remain unresolved.
As a union and as healthcare workers, we say government has a lot of priority to ensure that we have a well-established healthcare system that is working for the Kenyans, not to act as a cheap aid for our foreign powers. Government is actually now deliberately bringing the disease from DRC, from Uganda to the country. It's a bit an issue of concern. When we have a shortage of healthcare workers, we have had engagement with government to employ doctors. This has not been done for the last 5 to 10 years.
Among the facilities reportedly under consideration for quarantine operations is the Alupe Center in Busia County. This comes even as healthcare workers in the county begin an industrial strike.
Tuko hapa kujulisha umma ya kwamba mgomo wa wafanyikazi wa afya ulianza jana usiku.
We are currently dealing with the epidemic of Ebola. Busia County is a border county, and we are the first line of defense when it comes to handling some of these emergencies. Why would I handle a patient, offer services that I myself am not able to get in case I contract this disease?
Natoka Nairobi nenda Kongo, po Bukavu hapo, lazima watupime kuingia na kuondoka upande ya Rwanda huko.
Lakini upande wa Kenya labda
hata Kenya sijaona nini, tabia tunaona kama wameanza. Hapa Kenya bado sijaona kama wameanza.
Tuko na ugonjwa ambao ni wa Ebola, ulitokea kule Kongo, sasa umefika Uganda. Na sisi ni majirani wa nchi ya Uganda, so ningependa kuwasihi watu wetu. Ukisikia kwamba uko na kichwa kinauma sana, ama unatapika, unasikia kuchoka, please enda katika kituo cha karibu cha hospitali ili uweze kupimwa.
Already, leaders and Kenyans at large have expressed concern over the government's willingness to engage in talks with the United States regarding the quarantine of its citizens. Among the key questions being raised by Kenyans is this: if the United States, with a far superior healthcare system, is unwilling to admit infected citizens for treatment, how prepared is Kenya?